Good morning, everyone. Thank you for joining on. Welcome to the Multidisciplinary Approaches to Ending Homelessness COC webinar series. Um, I am going to allow just maybe 1 or 2 minutes to allow more people to join on our call. So if in the meantime, you can all please just sign in by signing your or typing out your full name, title, and agency or organization in the chat box. And we'll just give it a few more minutes for people to join on before getting started. Thank you. All right. Thank you again, everyone, for joining on. I'm going to give it about 1 more minute just to allow for more folks to join on, and then we'll get started. Thank you. Okay. Again, thank you everyone for joining on to our multidisciplinary approaches to ending homelessness COC webinar series. Thank you guys for joining on. I know some of you have been on here for a few minutes. So thank you for being patient and waiting for all of our folks to join on. I just want to go over the agenda quickly. So I'll just start off by introducing myself. My name is Valeria Cervantes, and I'm with the COC team, along with my uh, staff or with my colleague Gershom, Hiron, and other COC staff that are also on the call. Thank you guys all for joining us, and we're glad that you're able to join us this morning. So just with the agenda, we're did the introductions right now, going over the agenda, and then we will be having a informative presentation on understanding the Coordinated Entry System, or CES, that will be presented by Lucy Bustos from the Riverside University Health System Behavioral Health Division. And then after the presentation, we will have a Q&A session. So whatever questions you might have, please feel free to ask towards the end of the presentation, and we'll get those answered for you. Um, all right, so again, before we get into the presentation, just a little housekeeping rules. Um, Please make sure to keep your mics muted while the presentation's going on. Additionally, for those that have been joining on, if you haven't done it already, please sign in by typing your full name, title, and organization into the chat. Um, that way we can have attendance for you joining on today. So a little more housekeeping again, keep your mics muted. If you have any questions, you can raise your hand or you can type your question out in the chat box and we'll make sure to get it answered for you. Okay. So a little bit about our webinar series. It's just an opportunity for all of us to engage with local and regional experts to learn about best practices, resources available to prevent and end homelessness. For those of you who aren't able to join us live, who would like to rewatch some of the webinars from the past, are being recorded and they will be posted on our website. So please feel free to rewatch at your own time. We also have the slideshows available if you would like to see those. And if you'd like some assistance with getting access to those, just go ahead and email us at our CLC website and we'll provide that information to you. Okay. All right. So I'm going to go ahead and introduce our presenter for today. Her name is Lucy Bustos. And I'll just give a quick little bio introduction on her before I hand over the floor. So Lucy holds a master's in public health policy and administration from CBU. She's been working in the county social services for nearly 5 years. She started out with Riverside County, supporting over a caseload of 90 households in permanent supported housing through the HOPE program, with providing services to individuals with challenges like homelessness, substance use, and mental health needs. Today, she's a social service planner working behind the scenes with the CES team to help connect our most vulnerable community members to stable housing. So Lucy, thank you so much for joining us today. And whenever you're ready, I'll hand over the floor to you.
Yeah, I'm ready. Hi, good morning, everyone. Thank you
You.
for having me. So Valeria, you'll be going forward in the slides, right?
Yes, I have them ready.
Okay. So thank you all for having me. So I will be going over, as Valeria mentioned, the coordinated entry system basics. So the goal is to ensure, of course, that our partners know how CES works and why it's important. So next slide. So here's our agenda on the request of OHS and for our partners to be informed of today. So we'll start with an overview of CES, then walk through its functions, who has access, and what your role is as a partner. And then we'll have some time for questions and discussion. So what is the coordinated entry system? The coordinated entry system is, or otherwise known as CES, a central and standard approach to linking individuals and families who are experiencing homelessness with the housing and services that they need. It ensures that everyone is assessed in a consistent way. It helps prioritize the most vulnerable individuals for the limited resources that are available. Next slide. Its purpose, CES isn't just a best practice, it's required by the U.S. Department of Housing and Urban Development, otherwise known as HUD, for all continuums of care. So HUD is the federal agency that funds and oversees many housing and homelessness programs, such as the continuum of care. The goal is to make access to housing services more equitable and less chaotic. It also helps coordinate across agencies, reduce duplication, and serve people based on need rather than who shows up first. Next slide. So here's a referral process. It's how someone moves through CES. So first they connect with an agency. This could be through an outreach team or a walk-in into a shelter. They're then asked for consent to participate. After that, a standardized assessment is completed. After the service provider has built rapport with their client to understand their needs. Based on this, the system prioritizes them, and when appropriate housing resources are available, they're then referred. Slide. So actually for the last slide, the initial contact can also be done through Home Connect. That's also a way that members can call in and get linked to the coordinated entry system, as well as walking into a shelter or being outreached. And so on the next slide, there's like a little comparison between the two. Sometimes they're used interchangeably. So CES, it's the system and processes behind the scenes, and it's used nationwide and helps prioritize and match. Home Connect, however, is our front door, and it's client facing. It's the entry point. It's used solely in Riverside County, and then it helps people access housing services. Next slide. So assessment tools used in CES, most CES processes use structured assessment tools like the VI-SPDAT. These assessments look at things like someone's housing history, their health, their risk factors. Everyone is assessed the same way, so CES can make fair decisions and keep it consistent across the board. Next slide. So matching is based on a combination of different things. So it'll be clients' assessed needs and what housing resources are available at the time. So it's not generally a first come, first serve type of deal. It's case conference meetings are used. They're often used to review high priority cases and ensure that the right fit is used for those that are being case conferenced. Next slide. So who can access CES? Eligible agencies and staff can access CES. So this includes COC affiliated agencies, trained and authorized staff, as long as there are data sharing agreements in place. Next slide. So for a staff member to gain access to the coordinated entry system, the agency needs to have a memorandum of understanding with the COC. Staff must complete CES and HMIS training, which if you have not yet, feel free to reach out to me. Sign data sharing agreements and then be granted login credentials. So compliance is monitored on an ongoing basis. Slide. So we'll be going over some partner responsibilities. So collaboration for streamlined services. So it's important that agencies remain active participants, that they conduct assessments, they refer clients, and attend case conferencing sessions regularly. Regular communication with the CES lead helps ensure that everything runs smoothly and clients are supported efficiently, and there's that reduction of lapse in services. Next slide. So to be successful as a partner, we do recommend each agency assign a CES point person to serve as a liaison. Keep your team trained and up to date. Monitor your internal processes regularly and use your data to improve services and planning. Slide. So to wrap up, it's a fairly quick general overview, but CES is designed to make our system fair and efficient. But we can't do that without your participation as partners. So the more we collaborate and follow the processes that are set, the better outcomes we'll see for those that we serve. And for the last slide, I do hold meetings bi-weekly for CES partnership. So I see some of you on here that are part of those meetings. They're every other Tuesday at 9 a.m. It's a virtual. We have a resource track and we have a case conferencing track. So the resource track, I'll get agencies from different districts to come on, different services that they provide and present what their services are that are available to our consumers. And we also have a case conferencing track. So if you have members that you're finding difficult to house, we case conference it together with everyone that's on the call, and we try to break down those barriers to ensure that there's a more streamlined way to get them connected to services and get them connected to the housing that they may need. But other than that, I will be taking questions. If we have any questions, please feel free to unmute.
Thank you, Lucy, for that overview on the CES system. Again, for everyone on call, if you have any questions for Lucy, please feel free to either type it out in the chat box or raise your hand, and we'll go ahead and call on you. In the meantime, I do have some questions myself, so maybe this will get a discussion going, or bring on more questions. But would you be able to share what the client or member responsibilities would be so that agencies know what to remind their clients what their role would be with this program?
Yeah, so being consistent with your caseworker, being open with your caseworker. I, as mentioned in the beginning, I did case management for about 3 years. I can understand the barriers that come with working one-on-one with clients. Um, they're not often willing to answer the phone. They're not often willing to answer the door, provide the documents that are needed, but having that open communication with them of what's needed and why, I guess it falls on both the navigator, the caseworker, and the client. Keeping that rapport and ensuring that, okay, we're explaining why we need to do what we do, why we need to collect what we collect. That way the member can work with us and ensure that they are compliant on their part as well, so they can get access to the services that they need. It's just maintaining communication, maintaining these open relationships with them, just to ensure that we're getting them the help that they need.
Thank you, Lucy. Again, if anyone has any questions, comments, or anything they'd like to share, please feel free to raise your hand or type it out in the chat box. So far, I don't see any hands raised. But I do have an additional question. So this would be for service agencies or service providers. What could they expect or what not to expect in um, using the CAS system, just so that they um, kind of have an awareness of how to coach their staff when using the CES system.
Yeah, so I think a big one in my experience here so far is nothing's guaranteed, nothing's expedited, nothing is one day to another. We'll have case managers that can call in with their members and expect housing like maybe like within the same month. And unfortunately, that's just due to the resources. It's just not how we're able to navigate through it. I think currently, or last that was checked, there's about 800 members on the community queue. So the community queue is like the line in essence of like most vulnerable that will be scoring like the highest on the vulnerability index assessment. So there's quite a few factors. So there has to be that open communication. There has to be the vulnerability factors. So our connection to housing and our connection to services, it's based on need a lot of time. So we can have someone that's scoring like a 9, which is still fairly on the lower side of permanent supportive housing scoring. And though the navigators insistent on wanting to connect them to a permanent supportive housing opportunity when there's members that are scoring 16, 17, 18s and above. So I just want to reiterate that housing, it's not a guarantee just because you're going through the CES system, and it's especially not a fast track guarantee. So that is something to expect when maneuvering through the coordinated entry system.
Thank you, Lucy, for sharing that actual real-time timeline of how it works. I do see a hand raised, so Monique, please feel free to unmute and ask your question.
Good morning, everyone. Great job, Lucy. Thank you so much for this incredible presentation. I just kind of wanted to reiterate as well the importance of documentation for CES services in HMIS, because not only do we prioritize based off of scoring, we also prioritize based off of length of homelessness. One way we determine somebody's length of homelessness is how many services they have within our HMIS system. So it is critical that our service providers document every encounter that they have with their member, because that only increases their chances for housing.
Thank you, Monique, for sharing that and highlighting that aspect. That was a really, really great point to share and kind of emphasize as well. I currently don't see any questions on the chat. I do see a lot of kudos for Lucy. Great presentation is what I'm reading. But again, I want to give some time for those, if you have any questions regarding the CES system, if you or any discussion point you'd like to bring up, please feel free to raise your hand or type it out in the chat box. Um, Now is the time. Okay, I'm not seeing any hands raised or oh, I do see one hand. Go ahead, Elizabeth.
Hi, this is Lizzie from the HMIS team. I wanted to pose a question that was raised in one of our HMIS calls, and I think I've gotten clarification from this from John, but I just wanted to pose it in this setting as well so that other people can hear the answer. We had a question come up that was related to individuals entering rapid rehousing and when to exit them from CES and when to have them stay open in CES when they're enrolled in a rapid rehousing program. Would you guys be able to give a little bit more information on when the appropriate time is to exit somebody from the CES once they're enrolled in rapid rehousing?
So, through my experience with CES, and Monique, feel free to jump in, or John, we keep them open if and only when they are scoring higher than rapid rehousing. So if they're scoring into permanent supportive housing, because rapid rehousing can be used as a bridge into permanent supportive housing. So that way they remain on the queue and we know that they're still in a spot where they require a higher level of service and housing. So we would close them out of CES when they're put into a rapid rehousing grant or a program when they are only scoring within that allotted score, which is a 4 to a 7 on the BI-SPDAT.
Awesome. Thank you, Lucy, for that information. That's super helpful. If a client has been enrolled in a rapid rehousing program but hasn't yet moved into a unit, like let's say they're still in the search progress, should we have people leave them open in CES or should they be closed?
I would say leave. I would say leave open until there's a lease signing. That way we can close that loop on them with in a way where, because things can happen, right? They can lose communication with the navigator, in which case they would have to be reconnected to some type of service provider. But I would say leave them open until we can close that loop, and the closing of the loop would be hands in key in hand, and they're moving into a housing opportunity.
Awesome. Great information. Thank you so much, Lucy.
Thank you.
Thank you for bringing up those questions, Lizzie. Those were great. And thank you, Lucy, for being on here with us today and for sharing your insights on the CES system. I'm not seeing any more questions or comments in the chat or hands raised, so I'll do one last call. For any questions or comments, please feel free to raise hand or chat or type it out in the chat. Otherwise, we'll be returning some of your guys' time today and ending the meeting short. But again, just last call for questions or comments before we let Lucy go.
Hello, this is
Okay.
Natalis here from the Office of Homeless Services. Thank you very much for the detailed explanation of how CES works. And I also want to ask, is there any reminders or encouragements that you would like to ask the agencies who are using HMIS to, such as, I know that the CS team has been very diligent in doing your data cleanup in the CES project. Yeah. So are there any reminders reminders like what kind of information, what kind of major elements that need to be updated, not only in their own housing project, but also in the CES project, and also the importance of exit. Would you like to mention some reminders here for everyone?
Yeah, sure. So Monique gave a big one, documentation. It's a very crucial part of our roles here as partners. But yes, Natales, we are doing the data cleanup. And so we are asking our agencies that partner with us, when a member is exiting your services, your agency, and you are the last agency to be in contact with them, you're the one and only agency that's providing services. We do ask that they are also closed out of CES or removed from the queue or what have you, with the date of last service being reflective of the last service of your agency. That just helps ensure that there is no lapse in services. Now, if there's a member that's open to CES, they're open to your agency, and they're open to, I'll just use RUHS, Street Outreach. And you know you're exiting them, but you see that RUHS still has active, you see that RUHS still has contact with that member, but you no longer do. So we would encourage you to close them out of just your agency. But as long as you see that they're being contacted by a separate one, that's when we can leave them open. That just ensures data quality, and it ensures that there's a real snapshot, an accurate snapshot of who's being serviced and by whom.
Thank you, Lucy. And I believe that any major changes, yeah, and especially the annual assessments, yeah, it will be helpful for them to update both in their housing project and the CES project also, right?
Yes, so that just makes sure that we are aware of, and there's the accurate snapshot once again of what that member circumstances is as it happens, whether it's changes that happen throughout the year or changes that happen on a yearly basis. That's also
Yeah.
very important. Thank you, Natalis.
Thank you, because those are very, very important, because those that's what when housing opportunities come, and then whether they are eligible, and then to help them move forward to housing, and those are important information to be considered, right?
Yes,
Okay, thank you so much.
thank
That's
you.
it from me.
Thank you, Natalis. Thank you, Lucy, once again. I'll do another call for questions or comments. I haven't seen anything new in the chat, so if anyone is trying to type something out, maybe if you're able to unmute, feel free to do so and ask any question or comment. Just gonna check here to see if I see anything new. Okay, I'm not seeing anything. Lucy, I don't know if there's any additional um, information or just a little wrap up you'd like to share. Otherwise, I can go ahead and move on to the next slide. I don't see any new chat or questions, so I believe
No, I would just
okay.
encourage everyone, if they're willing and able, to attend the CS partnership meetings that's held bi-weekly. It's a virtual meeting, but if you are interested in attending or have staff that you think would benefit from those calls, feel free to reach out to me and we can get you a confidentiality agreement that needs to be filled out prior to your attendance. But that's all I have. Thank you, Valeria.
Thank you, Lucy, so much for joining us today and for sharing this overview on the CES system. If anyone would like to join on to this biweekly call with the CES team, please feel free to contact Lucy, or you guys can also contact us at the coc rivco.org email, and we'll get you guys connected. Um,
I'm sorry, one more plug-in from
Oh.
me, which is just as since we talked about the importance of exiting clients from the CES project and like not only moving forward, I would highly, strongly encourage all agencies to go back to your your CES, the CES projects, and then search for all the clients that you have had, maybe even in the past 5 years, because sometimes you may have past clients that you have exited from your housing projects, but not in the CES project. If all of you do that, and then it would be very, very helpful because like instead of CES team, one entity to have to clean up like over 1,000 records. Yeah, so that will be very, very helpful. Thank you all very much.
Thank you, Natalis.
Thank you. Thank you, Lucy, once again. I don't see any new questions or comments in the chat, so thank you all for joining us today on our webinar. Please, if you do have any questions that maybe didn't come during the time of this webinar, feel free to reach out to us via email, and I'm going to put that email in the chat right now, so you guys can all reach us. Also, the webinar and presentation slides will be available on our website. So please feel free to also review the material shared today there or a previous material. Additionally, if you guys would like assistance with access to that link, feel free to email us at the COC website and we'll get that to you. But again, thank you everyone for joining. Thank you, Lucy, and everyone from the CES team for coming on and sharing your knowledge on the CES system. If there aren't any other final questions on here on the chat or hands, I'll just go ahead and give back this time to all of you. And again, thank you for joining us.
Thank you.
Thank you.
Thank you, Lucy.
Thank you, CES team.